Question 15. What is the difference between a certificate program and certification? Answer. An approved certificate program can provide the coursework necessary to be eligible for certification as ABCBA or BCABA. A certificate program can also provide education that may be very useful to individuals not pursuing any kind of certification, such as some educators and parents. A certificate program must have the BACB approved sequence of coursework to count towards certification eligibility. Certification by the Behavior Analyst Certification Board is only available for people who already possess a master's or bachelor's degree in a relevant field, completed the required coursework, and who already have or will be able to obtain supervised experience in applied behavior analysis. Question 16. Is an ABA certificate program or ABA coursework just for people who want to become BCB, a certified behavior analyst? Answer. No, they are excellent for educators, parents of autistic children, social workers, special education teachers, health and human services professionals and more. Although these individuals may never pursue certification or work directly in the psychology field, board-certified behavior analysis courses help them develop their ability to identify and analyze root causes of performance problems and behavioral issues, as well as to develop interventions that address these problems in a systematic way. The concepts learned and the skills developed through applied behavior analysis can be applied for the betterment of many fields. It should be noted that many parents of autistic children enroll in ABA and ABA Autism certificate programs. Enabling families to access affordable and competent behavior analysts is an urgent problem because this is not an area in which do-it-yourself programming is advisable. Often, however, particularly for persons living far away from services, parents will have to assume major responsibility for their children's intervention programs. Question 17. Can I get my certification once I've completed an approved certificate program? Answer. No. The sequence of courses in an approved program has been approved by the Behavior Analysis Certification Board (BACB) to meet the coursework requirement for certification. However, for full BACB certification, students also have to complete the mentored and supervised experience requirement, for which they must make their own arrangements. Some programs will include this supervised field work as a requirement for completion. Finally, students must pass a certification exam administered by BACB. Question 18. Is a BACB certified behavior analyst the same as an autism specialist or therapist? Answer. Behavior analysis is an approach to human behavior that is not defined by a single diagnostic issue like autism. There are behavior analysts who work in prevention of violence at the Centers for Disease Control. There are others that consult to Fortune 500 companies on employee motivation and productivity, and still others that train human service animals. None of those BAs necessarily have any knowledge, training, or skill in working with people with autism, and yet they may well hold the BACB, a credential based on their training and supervision in those other very important areas. Applied behavior analysis has been the treatment of choice for autistic behavior for the past 30 years. There are several hundred studies published in scientific journals which show the effectiveness of ABA with persons with autism. Autism diagnoses have risen significantly and the disorder continues to receive extensive publicity. So, many people do mistake a behavior analyst as an autism specialist. Question 19. What is the career outlook for a behavior analyst specialist who specializes in autism? Answer. The demand for behavior analysts who specialize in autism far exceeds the number of persons with the expertise required to provide effective ABA programs. The diagnosis of autism is increasing rapidly. More than 5 lakh individuals under the age of 21 are currently diagnosed with autism. According to the US Department of Education, autism is expected to have a continued growth rate of 10% to 17% annually. The Centers for Disease Control estimates an increase from 1 in 150 to 1 in 110 children have an autism spectrum disorder. Such dramatic numbers and a shortage of qualified autism specialists create a strong demand for trained professionals. Question 20. What is the new Registered Behavioral Technician (RBT) certification? Answer. The Board of Directors of the Behavior Analyst Certification Board (BACB) B. has authorized the development of a new professional credentialing program for behavioral technicians, the frontline staff who implement behavior plans. The number of behavioral technicians has grown along with the demand for quality behavior analytic services. This growth, along with requests to identify and evaluate standards for behavioral technicians by regulatory and funding stakeholders, firmly establishes the need for a new credential. The RBT credential will complement the B, C, B, A, D, B, C, B, A, and BC ABA credentials as an entry-level program that reflects the education and training necessary for the duties of a behavioral technician. The implementation of this new credential will take time, and new developments will be noted as they are reported by the B, A, C, B. Question 21. How does the Intensive Applied Behavioral Analysis (ABA) program unfold from diagnosis to starting therapy? Answer. Children with a confirmed diagnosis of autism spectrum disorder (ASD) are referred to the Intensive ABA program. This diagnosis must be made by a pediatrician or a registered psychologist. Once we receive the referral, you will receive a letter asking you to contact the Intensive ABA program social worker to discuss service. The social worker will also help you connect with other services and supports that may be beneficial. If, after meeting with the social worker, you choose to participate in the Intensive ABA program, a senior therapist will be assigned. A senior therapist is a child management specialist that has specialized training in autism spectrum disorder and ABA. The senior therapist will call you directly to arrange visits with you and your child to complete a developmental assessment. This developmental assessment, along with input from you and any other relevant professionals who are involved with your child, will identify your child's strengths and needs and will form the basis of your child's therapy program. The number of home therapy hours your child will receive will be based on your child's age and the results of the senior therapist's developmental assessment. After this developmental assessment is complete, a meeting will be held to develop an individual support services plan (ISSP) for your child. If one has not been developed already, visits from your senior therapist will occur in your home on a weekly or bi-weekly basis. Question 22. What does ABA therapy look like? Answer. ABA therapy is designed to teach to the core features of autism spectrum disorder: social/play skills, communication and behavior. The Intensive ABA program employs only evidence-based treatments and strategies with demonstrated effectiveness. All learning is activity and play-based and is individualized based on your child's strengths and needs. The goal is always that your child will learn to transfer, generalize skills among a variety of environments. All of your child's programs should be explained to you in terms of how these are related to the goals set by you and by the ISSP team. Question 23. Is all therapy done in the home? Answer. Therapy will likely begin in the home. However, learning through generalization may take place in all settings the child may be in. Activities outside the home can be an important part of the home therapy program depending on the child's needs. Social skill development, for example, occurs best in natural social settings such as play dates, community outings, play groups, or child care settings. Question 24. Who is the employer of the home therapist? Answer. The Regional Health Authority provides the funding for the home therapist's salary, but parents are considered the employer of the home therapist. Government of Newfoundland Labrador covers the required employment insurance and Canada pension premiums but does not provide workers' compensation coverage. Question 25. What training will parents and home therapists receive? Answer. The Intensive ABA program provides an upfront 3-day training program. There is no cost for the training and it is recommended that parents, caregivers attend if at all possible. Home therapists are required to attend this training prior to beginning work with a child and they are paid for their attendance. Some of the topics covered include Intensive ABA program overview, roles and responsibilities, core features of ASD, evidence-based treatments, ABA strategies, individualized programming development, transitions, visual supports, behavior modification and fun and exciting therapy. Senior therapists also provide intensive hands-on training for the child's individualized programming in the home with the parents and home therapist on a regular basis and at every visit, as needed. Question 26. Should my child stay in childcare if he or she is already enrolled when therapy starts? Answer. The final decision rests with the parents with input from the results of the developmental assessment and discussion with the the ISSP team. Participation in childcare will be an individualized decision based on the needs of the child and the family. Question 27. How long will my child be eligible for home therapy? Answer: with adherence to the funding/service agreement. Funding is based on the child's age and the senior therapist assessment of their developmental needs. The intensive ABA program funding ends prior to grade 4 entry.